So for my assignment, I am doing the PIVM of the OA joint for flexion. So what we're testing here is we're testing the posterior glide of the occiput on C1. And the way we're going to assess that is we're going to have the patient lying in supine. You're going to cradle the head and you're going to put them in passive, putting them in capital flexion. You're going to place one hand on the occiput. You're going to take the other hand, you're going to palpate for the mastoid process, slide just inferiorly and laterally to the transverse process of C1. And you're going to take your MCP joint. You're going to press against that transverse process, creating left side bending and right rotation. What's that is testing? That is testing the right OA joint for the posterior glide. When you're done, you can switch hands, taking the left hand to the occiput. Again, feeling for the mastoid process, sliding inferior and laterally to the transverse process of C1, using that MCP joint to then create a left translation, which creates right side bending and left rotation. This is checking for the posterior glide of the left OA joint, and we can assess this by seeing if either joint is either hypomobile. And what this can do is, if we do have a hypomobile joint, we can actually take these PIVMs and use them for a first starting treatment to help increase that posterior glide. And then from there, you can also treat further with a contract relax PIVM of the OA joint, which hopefully will increase posterior glide and not have the patient in any pain.